Hello everyone and welcome to my channel. My name is Edna Dapper, and in my previous video I spoke about uterine or womb cancer. Today I will be discussing ovarian cancer, one of the gynecological cancers. The purpose of this series is to create awareness on this subject. Please join me as we continue impacting vital information on health matters for women of all ages. The ovaries are a pair of small organs and form part of the female reproductive system. It is located on either sides of the womb and stores a woman's supply of eggs. One function of the ovary is to generate and release eggs that combine with sperm to create a fetus. All mature eggs are conserved within the ovarian follicles, and every month about 10 to 12 immature eggs go through a process of growth, and one will usually continue to maturation until it is released during ovulation. The ovaries secrete estrogen, progesterone hormones, and very small amount of androgen and testosterone, the male hormones. As menopause approaches, the ovaries make less and less of these hormones, and periods or menstruation eventually stop. Ovarian cancer is common among postmenopausal women, and it is the sixth most common cancer among women after breast, bowel, lung, womb cancer, and melanoma. It is predominant in women aged 50 years and above, although it could also affect younger women. The disease occurs when abnormal cells in the ovary grow and divide in an uncontrolled manner and eventually form tumor. In most cases, diagnosis is made after the disease has advanced, spreading beyond the ovaries to the surrounding tissues. This explains the high mortality rate for this type of disorder. Also, lack of sensitive and specific screening method negates the diagnosis of early stage of ovarian cancer. Some symptoms of ovarian cancer are similar to symptoms for irritable bowel syndrome, IBS, or premenstrual syndrome, PMS. Symptoms of ovarian cancer include increased abdominal size, persistent pelvic and abdominal pain, unexplained change in bowel habits, difficulty eating and feeling nauseous, back pain, frequent urination, pain during sex, feeling constantly bloated. However, it is most likely that these symptoms are due to other conditions in the pelvic area and not because of ovarian cancer. So, a medical practitioner must be seen with any symptom experienced for adequate diagnosis. The exact cause of ovarian cancer is not known, but some factors may increase or decrease the risk of the disease. The risk of being inflicted with ovarian cancer increases with age, as most cases of the disease is diagnosed after menopause. More than 80% cases of ovarian cancer occur in women who are over 50 years of age. Family history is also an important factor because having close relatives who developed ovarian cancer could increase the risk of being visited with the disease. Ovulation is also a risk factor, as every time an egg is released during this process, the surface of the ovary breaks to let the egg out. This causes danger or damage to the surface of the ovary and will require repairs. There is a greater chance of abnormal cell growth during the repair process every time this happens, thereby increasing the risk of ovarian cancer. Women that use hormone replacement therapy, HRT, are at an increased risk of ovarian cancer. Endometriosis is a condition where tissues that behaves like the lining of the womb is found in the pelvic cavity. The cause of endometriosis is not certain, but could possibly be due to regressive menstruation. Menstrual blood containing endometrial cells, rather than flowing out of the body through the vagina, they decide to flow back into the pelvic cavity, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Women with endometriosis have a small increased risk of developing ovarian cancer compared to the general population. Genetic factor plays a role, as about 15 to 20% of cases of ovarian cancer are linked to a mutation in one or more genes. The risk of a woman developing ovarian cancer is significantly increased if she inherits a harmful variant BRCA1 or BRCA2 from either parent. Men and women who inherit a harmful variant may pass it to their children regardless of whether they suffered from the disease or not. BRCA1 and BRCA2 are genes that produce proteins that help repair damaged DNA. These genes are sometimes called tumor suppressors. So when they undergo mutations and lose their tumor suppression capabilities, they become harmful variants and could increase the possibility of cancer development. Women who smoke are 3 times more likely to develop ovarian cancer than women who do not smoke. Lack of exercise or inactive women are at an increased risk of ovarian cancer compared to women with moderate levels of recreational physical activities or who held jobs that require moderate or strenuous physical activities. Exposure to asbestos could significantly increase the risk of ovarian cancer. Asbestos is a naturally occurring fibrous silicate mineral that does not dissolve in water or evaporate. Some factors may reduce the risk of ovarian cancer, and these include taking the contraceptive pill, which prevents ovulation and will consequently save the surface of the ovary from damage, and subsequently repair process that would increase the risk of ovarian cancer. Pregnancy and having children stops ovulation for months. Therefore, the surface of the ovary is not damaged to warrant any repairs, thereby reducing the risk of ovarian cancer. Breastfeeding inhibits ovarian ovulation. As a result, reduces the risk of ovarian cancer. Diagnosis of ovarian cancer can be carried out with various tests that include the physical and visual examination of the pelvic area, blood tests for CA125 protein that is produced by some ovarian cancer cells, and biopsy of small tissue from the peritoneal cavity, and other X-ray and scan tests. The earlier ovarian cancer is diagnosed and treated, the better the chance of a cure. Unfortunately, the disease is often not recognized until it has already spread, making its cure very difficult. The cancer is staged to determine how far it has spread. In stage 1, the cancer is within 1 or 2 ovaries. In stage 2, the cancer has spread to the fallopian tubes or uterus. In stage 3, the cancer cells have spread outside the pelvis to the diaphragm and intestine and nearby lymph nodes. In stage 4, the cancer has spread beyond the abdomen to the lungs and spleen. The treatment for ovarian cancer depends on how far the cancer has spread and the general health of the woman. We have discussed all gynecological cancers, and I hope it has been very informative. We can see that lots begins to happen as we get older. Most of these cancers are prevalent in women over 60 years. Let's support our mothers and grandmothers with the awareness of these diseases. Thanks for watching, and please like and share this video with your friends and family. and I will see you soon.